A resident with dementia becomes agitated during bathing. What is the best first step for the CNA? A. Restrain the resident until the bath is completed. B. Speak calmly and try to redirect the resident's focus. C. Leave the resident alone in the bathroom. D. Forcefully continue the bath without interruption. Answer: B. Calm communication and redirection reduce agitation and help maintain dignity while still meeting hygiene needs. A resident with cognitive impairment repeatedly asks, "When are we going home?" The best response is: A. Ignore the question until they stop asking. B. Say, "This is your home now," firmly. C. Gently redirect to a calming activity or conversation. D. Remind them they cannot leave. Answer: C. Redirection reduces anxiety without creating confrontation or confusion, supporting emotional comfort. When caring for a resident with advanced Alzheimer's disease, the CNA should prioritize: A. Encouraging independence with complex tasks. B. Focusing on safety and basic comfort needs. C. Asking the resident to make major decisions. D. Testing their memory daily. Answer: B. In advanced Alzheimer's, independence is limited. Safety, comfort, and dignity must be the top priority. If a resident with dementia begins wandering at night, the CNA should: A. Lock the resident's room door. B. Gently guide the resident back to bed. C. Scold the resident for not sleeping. D. Restrain them to prevent movement. Answer: B. Gentle redirection back to bed ensures safety without punishment or restraint. What is the best communication approach with cognitively impaired residents? A. Use short, simple sentences and maintain eye contact. B. Speak quickly to keep their attention. C. Ask multiple questions at once. D. Avoid using gestures or facial expressions. Answer: A. Short, clear statements with eye contact help residents process and respond effectively. A resident with cognitive impairment begins shouting during meals. The CNA's best action is to: A. Yell back to quiet them down. B. Remove them from the dining area calmly. C. Offer comfort and determine if there is an unmet need. D. Ignore the behavior. Answer: C. Shouting may signal hunger, pain, or distress. Identifying the cause prevents escalation. Which activity is most helpful for a resident with early-stage dementia? A. Complex puzzles with timers. B. Simple familiar routines such as folding towels. C. Long conversations about current events. D. Giving them complete responsibility for medications. Answer: B. Simple, repetitive tasks provide purpose and reduce frustration in early dementia care. When a cognitively impaired resident becomes combative during dressing, the CNA should: A. Pause and return later when the resident is calmer. B. Restrain their arms. C. Call security immediately. D. Force the resident to dress quickly. Answer: A. Respecting the resident's mood and returning later helps avoid escalation while preserving dignity. Which safety measure is most important for residents with confusion and wandering risk? A. Leaving doors unlocked for easy access. B. Using alarms or monitoring systems at exits. C. Allowing residents to explore unsupervised outdoors. D. Keeping hallways dark to discourage movement. Answer: B. Exit alarms or monitoring help prevent unsafe wandering while supporting supervision. A resident with dementia clutches a stuffed animal for comfort. The CNA should: A. Take it away to avoid dependency. B. Allow them to keep it as a source of reassurance. C. Hide it when family visits. D. Replace it with another item daily. Answer: B. Comfort objects reduce anxiety and provide security without harm. Which environment is best for reducing confusion in cognitively impaired residents? A. Quiet, familiar, and structured surroundings. B. Constantly changing decorations and furniture. C. Bright flashing lights and loud music. D. Large groups with unfamiliar people daily. Answer A. Familiar, calm environments support memory and reduce anxiety in dementia care. A resident with dementia insists it is morning when it is evening. The CNA should A. Correct the resident sharply. B. Argue until the resident accepts the truth. C. Validate feelings and gently redirect. D. Force them to look at the clock. Answer C. Validation reduces stress, gentle redirection is more effective than confrontation. If a cognitively impaired resident becomes suspicious and accuses staff of stealing, the CNA should A. Argue and prove the accusation wrong. B. Defend themselves aggressively. C. Stay calm, reassure, and redirect. D. Ignore the resident completely. Answer C. Reassurance and calm redirection reduce paranoia without escalating conflict. When feeding a resident with cognitive impairment, the CNA should A. Offer one food item at a time with clear instructions. B. Place all food in front of them at once. C. Feed them quickly to finish the task. D. Avoid assisting even if they struggle. Answer A. Simplifying choices reduces confusion and promotes dignity during meals. Which approach encourages independence in residents with mild dementia? A. Provide step-by-step instructions with support. B. Complete all tasks for them. C. Give no instructions and wait. D. Force independence without help. Answer A. Step-by-step support balances independence with necessary assistance. A resident with Alzheimer's keeps packing clothes to go to work. The CNA should A. Remind them they are retired. B. Redirect by offering an activity related to work. C. Hide their clothes to stop the behavior. D. Argue until they stop. Answer B. Validation and redirection respect their feelings without confrontation, easing distress. Which nonverbal cue helps when speaking to cognitively impaired residents? A. Smiling and gentle touch. B. Crossing arms while talking. C. Standing far away. D. Speaking without eye contact. Answer A. Positive body language like smiling and gentle touch supports trust and comfort. A resident with confusion becomes restless in the afternoon. This may indicate A. Sundowning. B. Dehydration. C. Hunger only. D. Morning anxiety. Answer A. Sundowning is common in dementia, where confusion and agitation increase in the late afternoon and evening. If a resident with cognitive impairment resists toileting, the CNA should A. Use a calm approach and try again later. B. Force them immediately. C. Ignore toileting needs. D. Argue until compliance. Answer A. Patience and returning later avoids distress while ensuring needs are met safely. Which type of activity reduces agitation in cognitively impaired residents? A. Loud, fast-paced games. B. Familiar, calming music or simple crafts. C. Competitive quizzes with scores. D. Strict timed exercises. Answer B. Familiar and soothing activities reduce stress and support well-being. When communicating with cognitively impaired residents, CNAs should A. Use the resident's name often. B. Speak rapidly with long instructions. C. Avoid gestures. D. Change topics frequently. Answer A. Using the resident's name maintains focus and familiarity, supporting communication. A resident becomes anxious when surrounded by too many people. The CNA should A. Remove them to a quieter area. B. Force them to stay. C. Increase stimulation with louder noise. D. Ignore their anxiety. Answer A. A calm, quiet environment prevents overstimulation and supports comfort. If a cognitively impaired resident refuses meals often, the CNA should A. Offer smaller portions more frequently. B. Force feed immediately. C. Remove meals without trying again. D. Only offer liquids. Answer A. Small, frequent meals reduce overwhelm and encourage better nutrition. A CNA notices a resident with dementia pacing repeatedly. The best action is: A. Allow safe pacing and monitor closely. B. Restrain them to stop pacing. C. Force them to sit still. D. Ignore them completely. Answer A. Safe pacing can reduce anxiety. Monitoring ensures safety without unnecessary restrictions. Residents with cognitive impairment may feel safer when: A. Routines are predictable and consistent. B. Daily routines change constantly. C. Staff speak in complex medical terms. D. They are moved to different rooms often. Answer A. Predictability reduces confusion and helps residents feel secure.